Hello everyone, in this presentation we are going to talk about our recent research work on prediction of Alzheimer's disease progression based on multimodal data and visual explainability. First, we will answer a simple question: what is Alzheimer's disease? Alzheimer's disease is a progressive neurological disorder characterized by loss of cognitive abilities. Patients with Alzheimer's disease face extreme difficulty in carrying out routine tasks such as losing their ability to solve a problem, plan, reason, use judgment and, clear that causes mood and personality shift. Early detection of Alzheimer's disease is very important for slow the disease progression and provide an effective management of patient future. For that purpose, doctors and medical experts normally conduct different types of medical tests such as MRI and cognitive tests. MRI images are one of the important modalities to investigate the anatomical structure of brain tissues for early detection of Alzheimer's disease. Other modalities such as blood tests, cognitive scores, and demographic features are also used for detecting Alzheimer's disease. Here we are going to present the proposed framework for detecting Alzheimer's disease. We used longitudinal MRI fused with cognitive scores and demographic features. The progression detection is performed based on the fusion of multimodalities. Furthermore, we utilized longitudinal MRI because baseline data of a patient doesn't have enough amount of information about the progression of Alzheimer's disease. The proposed framework detects the progression of Alzheimer's disease in 4 stages. MRI images preprocessing, deep features extraction via 3D CNN, and recurrent neural networks for temporal features learning, and explaining the output of the proposed network. In the first 2 stages, we perform data preprocessing and deep features learning using 3D CNN. Data preprocessing is a very essential step in deep learning-based data processing. The main processing steps involved in this study are bias field correction, skull stripping, and registration to MNI template space. Furthermore, a 3D convolution network is used to detect deep features from the 3D MRI volume. The use of 3D CNN is to capture spatial features as well as intra-slice correlation of the MRI volume. Instead, 3 sequences of deep features are passed to the recurrent neural network to capture the temporal features. The output of the BRNN is fused with other modalities such as cognitive scores and demographic features and is classified as normal or diseased patients. At stage 4, an explainable AI approach is proposed that shows 2 and 3D explanations regarding the progressive deterioration of the damaged tissues in the brain over time. In this slide, we show our proposed approach for explaining the diagnosis decision of our framework. For the explanation to the medical expert, we present multiple slices from a patient's MRI volume to show the activated voxels of a healthy person. These activated voxels called attention maps are provided by the proposed deep learning network at different for a single patient. Here you can see that we have the attention maps that highlight the main regions of the brain that contributed to the deep learning model decision at the first visit MRI image, time step 1, month 6, time step 2, and month 12, time step 3. Also, we provide a 3D explainability for these brain active regions. Cognitively normal people, the network has detected the same regions at all time steps that make them different from Alzheimer's patients that we will see in the next slide. Here, we show the proposed explainability illustrations for the other 2 cases, that is progressed patient and Alzheimer's diseased patient. For the progressed patient, we see that the activated brain regions at the first visit are the same as healthy person. However, during the 6 months period more brain regions were activated, which represents the deterioration in the hippocampus and amygdala regions. At time step 3, half of the brain tissues was deteriorated, representing this patient as a complete Alzheimer's diseased patient. This explainability shows the progressive deterioration of brain tissues with respect to time. For the Alzheimer's diseased, the explainability showed the same activated brain regions at all time steps. This is the end of this presentation. For more detail, you can visit our website. Thank you.